There are broadly two main categories of testicular cancer, seminoma and non-seminoma. Within the non-seminoma category, there's four subtypes: embryonal, yolk sac, choriocarcinoma, and teratoma. Now that we've talked about the diagnosis, and before we move on to discuss treatment options, let's take a step back and discuss how the cancer developed in the first place. This is called disease pathogenesis. Now, it all begins with a single cell. If you look at the top row of this image, it shows how a healthy primordial germ cell differentiates and eventually matures to become a spermatocyte. Germ cell cancers are thought to result from problems with this process and basically difficulty differentiating, specifically germ cell neoplasia in situ cells, which is really a fancy word for early cancer cells, may result from failed differentiation and acquired genetic changes that allow for propagation of the cells to become either seminomas or non-seminomas. So now that we have established that there are two primary types of testicular cancer and how they develop on a cellular level, let's compare them. Karan, can you tell us a little bit more about how we may expect these two histological subtypes to behave differently?
Yeah, so thanks, Jennifer. I think you did a wonderful job in sort of going over the brief history of how testicular cancer is distributed and what is the genesis of testicular cancer. So, as you correctly mentioned, there are two types of testicular cancer. One is seminoma and one is non-seminoma. Now, the important factor between seminoma and non-seminoma is the way we view it is non-seminoma is thought to be more aggressive than the seminoma. Seminoma, while is has what we call as good prognosis and is less rapid, and is also very sensitive to chemotherapy as well as radiation therapy. Whereas non-seminoma, given its heterogeneous nature, can be little less sensitive to radiation or even chemotherapy and might need more surgical expertise and surgical management, so to speak. The important thing about testicular cancer overall is that all the testicular cancers have really good survival rate. And that is something we need to know because a lot of the management in testicular cancer is driven by short-term and long-term toxicities in these patients.